Medurstand. Understanding medicine.
Welcome to Medurstand, ladies and gentlemen. We are again with our second episode on hepatitis. Last time we covered hepatitis C, and Professor Aftab Mohsin told us that there has been very, very exciting developments in hepatitis C, and it is literally possible to eradicate in the world. Everybody has to play their role, particularly doctors. And he mentioned that main spread of hepatitis C is through doctors, so we have to correct our practices, but also those who are not actually healthcare professional, but they're practicing medicine. So today we are going to cover hepatitis B. Professor Aftab Mohsin, professor of medicine, ex-principal of Gujranwala Medical College and ex-principal of Rashid Ali Medical College and ex-chair of National Hepatitis Control Program and current Vice President, Pakistan Society of Internal Medicine is again with us. Welcome, Professor Aftab Mohsin.
Thank you, sir. I'm very grateful for the kind invitation.
Today we're going to talk about hepatitis C. Hepatitis, the biggest hepatitis B, the biggest success point in the history of hepatitis B is the development of vaccination. Can you highlight how we developed it and who should receive it? Everyone or some selected people should receive it. Please guide us on hepatitis B vaccine.
In countries where the prevalence is intermediate, as in Pakistan, which is about 2.5% prevalence in Pakistan, everybody should receive the vaccine. And fortunately, it is now part of EPI. But there is one small hitch even in EPI. It is part of pentavalent vaccine that you give hepatitis B vaccine. But the first dose is given at 6 weeks. So the first dose is given at 6 weeks. That is not sufficient to stop vertical transmission from mother to the newborn. इसकी 3 modes of transmission है. Unlike hepatitis C, which is mainly transmitted through the skin, and it is through a skin puncture by a medical device like a syringe or some other medical device. इसकी 3 mode of transmission है, or through the skin, or mother to child, and sexual intercourse, which is either between men and women or men and men, or that's very significant. And especially men and men sex, जो है, it is incriminated with higher transmission. तो जो मदर टू चाइल्ड ट्रांसमिशन है न्यूबॉर्न, वो आप जो मौजूदा EPI प्रोग्राम है उसमें नहीं प्रिवेंट कर रहे. और पाकिस्तान इज इंटरमीडिएट प्रेवलेंस, एंड अ बर्थ डोज और अ बर्थ डेट के ऊपर जो डोज है वो अभी नहीं पार्ट. तो वो हम यूं करते हैं कि जो डॉक्टर्स माशाल्लाह गायनेकोलॉजिस्ट आर स्क्रीनिंग नाउ. इट्स पार्ट ऑफ द एंटीनेटल केयर दैट दे आर स्क्रीनिंग मदर्स फॉर हेपेटाइटिस B and C, and they are offering birth dose to the newborn. लेकिन अगर mother positive है for hepatitis B, then the newborn will also receive immune globulin, hyperimmune globulin on the date of birth. तो अगर ये भी हो जाए तो it will be even better. But now everybody is being vaccinated. It is a huge initiative. I must congratulate the government of Pakistan for this. And this also credit goes to the pediatric societies, because they were instrumental in bringing hepatitis B vaccine in the EPI program.
How about the treatment of hepatitis B? Can we cure hepatitis B like we can cure hepatitis C?
No, sir. Under the present armamentarium that we have very effective drugs, but they cannot eradicate. And it is said that the suppression is the name of the game. For hepatitis B, we cannot eradicate, we cannot cure, but we can suppress the virus and we can prevent the people from having complications. The 2 most dreadful complications are cirrhosis and HCC, hepatocellular cancer. And both can be prevented by effective suppression. Unfortunately, there are only very few medicines available In fact, sir, now there are only 3 medicine available in Pakistan, other than interferon, which hardly anybody takes. So entecavir and tenofovir and tenofovir alafenamide. So basically, ये 3 दवाई हैं, and they are very effective. They suppress, but they work only as long as you give. And many
So
patients
does that mean that if somebody has hepatitis B, he has to be on medication for life?
now there is a lot of debate on this. This is still not 100% agreed upon by the scientists, but generally it is true that if you have hepatitis B, you should be on the treatment for life. Lekin especially for hepatitis B E antigen negative people. मैं इसकी उसमें नहीं जाना चाहता. मैं कहता हूँ everybody and Asia Pacific में especially वो कहते हैं it should be on treatment because we have very high prevalence of HCC, and HCC can occur in hepatitis B as opposed to hepatitis C without going into cirrhosis. तो यहाँ पे जो है patient can become sufferers of HCC, hepatocellular cancer, without actually having cirrhosis. जबकि hepatitis C में पहले fibrosis होगा, फिर cirrhosis होगा, फिर cancer होगा. ऐसा यहाँ नहीं है. Everybody who has hepatitis B DNA positive and ALT, AST raised or inflammation on liver biopsy must be on treatment. और अब तो वो भी उन्होंने सर निकाल दिया कि डीएनए की वैल्यू कितनी हो, बस पॉजिटिव हो और वायरस पॉजिटिव हो, ट्रीटमेंट दे और लाइफ लॉन्ग.
And how common is hepatitis B and C co-infection? And are there any different treatment challenges, or we simply give treatment of both together?
Yeah, that is a very good question. That can only come from a healthcare worker who has vision and who has in-depth understanding of this problem. Co-infection is not a major problem. We see it, and we see it regularly, but it's not common. Say if I see 100 patients of hepatitis C, 2 or 3 may have co-infection in my practice. Because hepatitis C is a very common problem, if one has hepatitis C and hepatitis B co-infection, then one has to treat hepatitis C obviously. HCV RNA positive means treatment. उसमें आपने कोई और fulfill नहीं करना चाहिए. लेकिन now in Asia Pacific they say as you are treating hepatitis C in a patient who has hepatitis B surface antigen positive for the duration of 12 to 24 weeks. जो भी आप देंगे 12 weeks for non-complicated and 24 weeks for cirrhosis. You must give hepatitis B treatment also for that duration. अगर hepatitis B surface antigen positive है और DNA positive नहीं है, फिर भी treatment देनी. और अगर HBV DNA PCR positive है, फिर तो आप मैं कहता हूँ लाइफ लॉन्ग ट्रीटमेंट देंगे. और लेकिन C को आप 12 से 24 हफ्ते देके बंद कर देंगे. जिसका डीएनए पॉजिटिव था, ना सिर्फ उसको ट्रीटमेंट देंगे लाइफ लॉन्ग, बल्कि उसका सर्वेलेंस करेंगे एवरी 6 months फॉर HCC ड्यूरिंग ट्रीटमेंट आल्सो एंड लुक फॉर ट्रीटमेंट फेलियर्स. इसमें एक टेस्ट और ऐड हो जाएगा सर कि अल्ट्रासाउंड, अल्फा फीटोप्रोटीन एंड HBV DNA PCR. एंड आई रिकमेंड दैट वी डू क्वांटिटेटिव टेस्ट. वैसे क्वालिटेटिव इज चीपर बट क्वांटिटेटिव is better. लेकिन अगर आपने उस स्कूल ऑफ थॉट पे जाना है कि जिसका भी है ट्रीट करना है, तो फिर क्वांटिटेटिव की भी जरूरत नहीं है. क्वालिटेटिव इज चीपर.
And what are your recommendation about hepatitis E and hepatitis A vaccination in those who are suffering from chronic hepatitis B or chronic hepatitis C?
ए का तो पाकिस्तान में आपको पता है कि prevalence is very high in adult population. 90% plus people have been exposed and they have antibodies. And once you have antibody, you have generally got immunity against it. So for hepatitis E, yes, it is a good thing. But we have vaccine which is from China, and I gave it to some people, but it is not approved by FDA. So in US, but we use it here in people who have this, and I especially recommend it to women of childbearing age कि अगर वो आए और वो इसके लिए कंसर्न हो, लेकिन it has not become a common practice to use hepatitis E vaccine. Or hepatitis A vaccine is now part of pentavalent vaccine program, वो जो
Right.
पाकिस्तान, तो independent vaccine एक ही available नहीं यहाँ.
Okay. Now, coming back to vaccination, if somebody with hepatitis B who has been vaccinated, somebody who has been vaccinated with hepatitis B vaccine, and he gets a needle prick injury, can he assume not to take any further action because he is immune, or is there any way of testing his immunity status?
No, there is a protocol. Usually, they are healthcare workers or people who have people suffering from hepatitis B in their homes. So, first of all, is that you know the status of the person from which the needle stick injury has occurred, and to which whom the needle stick injury has occurred, and he has received vaccine. The vaccine is only 95% effective. So, you have to get anti-HBs antibody titer
Okay.
on day one, and you must give वैक्सीन का बूस्टर डोज एनी डे. अगर उसको वैक्सीन लगी भी हुई है या नहीं लगी हुई, तो यू शुड एडमिनिस्टर हेपेटाइटिस बी वैक्सीन अगर पॉजिटिव था. और अगर एंटी एचबीएस एंटीबॉडी टाइटर 10 से ज्यादा है, तो फिर आप बच सकते हैं कि ना लगाएं, लेकिन उसमें कई दफा टाइम लग जाता है, 2 दिन 3 दिन लग जाता है. तो इट डिपेंड्स, लेकिन टाइटर कराना जरूरी है जिसको नीडल स्टिक हुई है. और अगर उसका टाइटर कम है तो वो ही विल गो थ्रू द एंटायर प्रोग्राम ऑफ वैक्सीन, वो 3 डोजेस लगवाएगा और प्लस हाइपर इम्यून ग्लोबुलिन लेगा 0.06 ml पर किलोग्राम ऑफ द बॉडी वेट. अगर टाइटर ज्यादा है और सिग्निफिकेंट है तो सिर्फ लगेगी बस.
Right. Do you think hepatitis B vaccination should be mandatory to uh, the medical students, for medical students when they enter medical colleges? Do you think they should be?
It should be made mandatory by a legislative process. Okay, when I go in the ward and I am taking classes, as you are also very fond of teaching, so 30 to 40% people are still unvaccinated, even when they're doing their house jobs. So it should be made mandatory by the government of Pakistan, at least for healthcare workers and commercial sex workers, that they should have hepatitis B vaccine.
Okay. And what is the approximate prevalence of hepatitis B versus hepatitis C in Pakistan? Are they equivalent, or which one is?
I said that we are in intermediate uh, range country. The hepatitis B prevalence is 2.5% overall. It is more in KPK and certain areas of Balochistan. And then there are areas of Balochistan and Sindh where there is hepatitis D, Delta virus.
Okay.
There are few districts where you have co-infection of hepatitis D and B. As you are aware that Delta virus is not an independent virus and it can only live with hepatitis B. But the problem is once it coexists, then these antiviral tenofovir or tenofovir, alafenamide and entecavir, they don't work. Then they have to be treated with interferon, and the dose is for 48 weeks, up to 72 weeks. But it's not very effective. And the dreadful thing is when this is co-infection, that both occurring together, but the superinfection is very bad. If hepatitis B patient gets Delta virus over and above B, then it can rapidly kill the patient. And it is a risk to healthcare workers also, because especially people, healthcare workers in Karachi, they get people from Balochistan as well as Sindh, and they have this risk of Delta virus infection. अगर nurses को और doctors को, surgeons को हो सकता है, dentist को, तो they have to be very careful. तो जब भी B positive हो, तो hepatitis delta का जो है टेस्ट जरूर कराना चाहिए.
Right.
Especially where persons are coming from TG Khan, Rajanpur, Jafarabad, and districts of Balochistan.
Thank you very much, Professor Mohsin, for very, very enlightening views on hepatitis B. That concludes our second episode on hepatitis B. Ladies and gentlemen, Please join us on our third episode, which is going to cover NASH and CLE. Thank you.